Hi, I'm Dr. Todd Pesic. I'm a holistic medical doctor. I was one of a small cohort of students at Ohio State to be selected to train full-time at the Cleveland Clinic. And recently I am the author of Eat Yourself Super.
My name's J.D. Meyer. I still went on to get a master's degree, and I've taught 20 years, including 10 years of developmental English.
Hi, my name is Tiffany Vasugi, and I am a registered nurse.
My name is Sylvester Young. I'm a doctor, a medical doctor practicing in Singapore. Initially, my interest has been in the field of geriatric medicine.
I'm a 76-year-old woman. I wish to finish the rest of my life with a quality of life. I have spent some time as a hospice volunteer, and I have been with people as they end their lives in some really heartbreaking, situations. And I feel that's entirely unnecessary.
There's absolutely no question that the majority of morbidity and mortality simply need not exist.
Okay, hey, I'm Ryan Sykes, from Los Angeles, California. Former ball player, played 6 years professionally in the Arena Football League. Last year was in 2006. I'm one of the regional scouts for USA Football, father of three.
My name's Connie Horniak, and I'm a licensed clinical social worker. I have a private practice in Santa Ana, California, and I specialize in working with children who have reactive attachment disorder and post-traumatic stress disorder.
Our body is challenged with the task of maintaining a relatively stable internal environment, a very narrow internal environment that is capable of holding life.
The intestinal flora, which when compromised will also affect the immune response. It reduces our immune abilities, and that leads to the flourishing of the internal biological terrain that will negatively affect our body. There's bugs in our body like parasites, yeast, and bacteria. So there are consequences of bowel dysfunction that will lead to all these imbalances and ultimately lead to disease state.
The diseases that exist are really of two flavors: toxicity and trauma.
I was diagnosed with glaucoma about 8 years ago, but I've managed it, fairly well. It almost took my eye, and I was, taken to the hospital on an emergency.
Colonics has been something that I've been interested in trying for myself for a long time, but it took me getting sick to really decide to take the plunge. Basically, it ended up being viral meningitis.
I do see children with Asperger's disorder, which is high on the autism spectrum.
Sure is.
They many times have dietary issues. They will perseverate on a topic or sometimes on a food.
I experienced, after a couple years of retirement, valley fever.
I had cerebral meningitis when I got out of high school, and I am one of the few survivors of that.
A fungal virus that attacks your lungs, and it almost brought me to my grave.
Oh yeah, and right after I got out, and I was talking like that for a while.
I went to the hospital and they did a spinal tap, they ran blood, they got me on IVs and morphine and steroids and trying to get the swelling down in my brain.
I was on Dilantin and phenobarbital for a few years. Then after the nerves breakdown, I was on lithium carbonate, Navane, and Artane.
I went from 240 pounds to 190 pounds within a matter of months. Fast forward weeks later that I woke up in a hospital.
They didn't really know what I had. The aftermath is still there. Like, gee, why don't I recognize what car I came in when I come out of the store stuff,
The doctor at the time who treated me kind of presented the idea that, hey, if it wasn't for your health, we might have went home to see our maker.
I felt that my body chemistry was really compromised, especially during the 6 months of antibiotics.
The swelling in my face, in my abdomen, I had just huge bags under my eyes. I knew that I was really, really sick.
I mean, it's necessary at times, of course, and it was this time, otherwise I wouldn't have done it. But it also affects the rest of your body. and especially, your colon and so on and so forth.
The fact that toxins build up in the body can lead to a series of adverse consequences or negative consequences, such as skin problem, allergies, eczema. They could have sinus problems.
See, I was diagnosed with asthma in '87, and then I started coming here probably in '02 or '03, which was before the emphysema of '05.
If children are going around with their tongues white, craving sugar, stealing candy at school, doing everything they can to feed the candida, obviously their behavior is going to be worse, and then they have stomach aches and headaches, and they're always in the school nurse's office, so they're not attending class very much.
Our body's elimination of toxins, metabolic wastes, and also toxins that we take in from our environment is crucial to our health for a number of different reasons.
When I came home from the hospital, I realized, I put it all together, that I hadn't gone to the bathroom.
There's absolutely no question that an improperly eliminating bowel basically causes a growing toxic burden to that person.
To me, I'm a medical doctor, and I believe everybody is constipated.
The sages the world over, whether they were the Vedic sages, the ancient Maya, they all talk about the same thing, and it's regular elimination.
On a Sunday afternoon in Frantic, I thought, hey, what about doing a colonic? Let's try to get these toxins out of me, the steroids, the morphine, everything that I had been on.
And then I got introduced to colon hydrotherapy just by accident. And the more I got into it, the more I realized how useful this simple procedure was.
They've been doing enemas and colon irrigation in rivers even since time immemorial.
Then I discovered colon hydrotherapy to my natural propensity for research.
I carry out the procedure, I see the outcome, and I know what's coming out and what's causing the problem.
I had all kind of mixed thoughts going in.
Parents were very pleased. Initially, there's a little hesitancy because they think about being given enemas when they were children and they didn't like it and that sort of thing. But once they meet the colon hydrotherapist and they find out what's involved and maybe experience the session themselves, then they really can see the benefits.
Then I did more research about those who actually done it, and I was given I guess a prettier picture of the scenario.
I mean, colon hydrotherapy in the process helps them activate and clear out the waste from the body and indirectly improve their health. So that's one group. Now the other group of patients or clients are those people who has obvious bowel-related problems, of which constipation is one of the most common, and as well as irritable bowel syndrome. And I treat a lot of these cases.
It's been helpful to them and their parents to get good guidance through colon hydrotherapy and nutrition, to change their internal structure as well as working on their behavior. I just find that if they can go to colon hydrotherapy, it reduces the amount of medication that they have to take, and some of them have been able to get off of it altogether.
It sounded like a good idea to me because I knew my diet had been heavy on the burgers and fries when I was younger, and probably not enough cabbage in the world to make up for it.
I was a regular once a week for at least 6 weeks.
When they go through a series of colon hydrotherapy sessions, it's not uncommon for them to weigh 10 to 15 pounds less.
And sure enough, with the first times I did it, 5 to 10 pounds of dried what.
What I was most shocked about was not the amount of feces that came out, but the amount of bile from the liver dumping, which it was amazing to me. I never thought that could be possible.
I just felt like, wow, like this is amazing. Like the things that we consume, and it just stays within a certain region of the colon, the body, and this is a procedure that can release that.
The most dramatic case I have is a case of an 80-year-old person, male, who had an abdomen that was distended about, that's full and distended and firm, hard, and he was in distress. He was actually advised surgery if he doesn't get surgery, he would die. And the family was against surgery. They thought he was 80 years old. I had a picture of him one day after and then 1 week after, and it was like, half the size and all that.
The next morning, I woke up and I felt more clear-headed and I felt like a little bit less fatigued.
I, actually signed up for a series of colonics because I was leading towards a liver detox.
I walked over, I looked in the mirror, and I was like, oh my gosh, what happened? I look almost normal.
The foods that I've eaten over the last maybe 4 days or so, here it is on the monitor and it's coming out.
That's when I was utterly amazed at what came out.
Many of these problems can be resolved because of after the procedure of colon hydrotherapy, simply because of the effect of hydration and clearing of waste, and indirectly it leads to the improvement in the problem.
I see about 28 families a week. I would say at least 10 of those children have needed some type of colon hydrotherapy and or diet correction.
So for me, I feel like it just kind of rebooted the system a little bit. And I was able to, I believe I went to the bathroom that next day normally without any problems.
Within a short time, I was having regular bowel movements.
People should eliminate at least on minimum daily.
Then I noticed, gee, a lot of this mucus, it's gone from my nose to lungs to stomach. Gee, that's flying out of there too.
I lived a good lifestyle in terms of my physical condition. That saved me. Colon hydrotherapy was a situation where it enhanced me.
I don't have any idea how long that would have taken my body to get rid of those toxins that had built up for the last week of all the stuff they were putting in my body, how long that would have taken to do on its own.
If we really can allow things to move and be eliminated from the body, you actually get rid of a lot of the obstacles to healing, and that's important.
What I'm going through right now, I call a healing process, and it helped very much get me to this point.
I think that people with chronic illnesses or acute illnesses, like what happened to me, could benefit so much from colonics.
I think that if more people knew about it and would avail themselves of this service, we probably wouldn't need so much in terms of medication or psychotherapy. Maybe I could work my way out of a job.
Having gone through, the colon hydrotherapy, I'm able to answer questions and educate folks on, how important it is to cleanse our colon.
My take on complementary practices is really about maintaining and improving function to avoid disease, whereas conventional medicine is about treating disease when you have the problem already.
Actually, there's one organization that I belong to that's it's the Association for Treatment and Training in the Attachment of Children, and they're very open to alternative treatments for children with reactive attachment disorder.
My primary care doctor, Dr. Ellen Barnett, she said, yay, can't hurt, honey, go for it. Glaucoma doctor, who is a man. I don't know if that makes a difference. Right. I really don't. But he said, oh, yeah, okay, well, go ahead and try it, okay. I'm making much more progress now with lowering my eye pressure and things like that as I detox my body.
I feel like when every patient gets discharged from the hospital that's been in for any long period of time, they should automatically be given, a card to go in and start doing colonics.
I'm in class with a lot of people my age, who are, number one, looking worse and have far worse health problems than I do. I don't take anything else except eye drops for my glaucoma. That's it.
Colon hydrotherapy could definitely benefit a lot of people.
I believe that everyone should have a colonic because I think everyone has a different experience. And some people may just do it just to kind of feel like they're flushing their body out. Other people that are very sick, I think about the cancer patients and the patients on chemo and radiation or on long-term chronic medications or anything like that that is just sitting there in their colon and in their digestive system and trying to get that stuff out.
You know, I did it and it's been great.
Children, adolescents, adults, every cancer center, every kidney dialysis center. I mean, there are so many people out there that are chronically sick, not even just the acute sicknesses like the viral meningitis that I had, but so many people that could benefit from getting that toxins, getting that medication out of their system. They would feel so much better.
So the prevention of the problem is really maintaining a healthy bowel function through regular elimination.
Oh yes, colonics is definitely a good idea.